Well, hello, everyone. My name is Ana Garcia Reyes. I am the Associate Dean of Hostos Community College. I am very happy to be moderating this workshop with distinguished doctors that we have here that will be part of the lecture. And this is, of course, the Dr. Nasry Michelen Alliance Health Lecture Series. And this is the first lecture of the fall semester. So with that, before I introduce our distinguished guests, allow me to introduce our distinguished president, la doctora Daisy Cocco de Filippis. Buenas tardes, doctora.
Thank you, Ana. Thank you, Dean Garcia, Reyes. And hello, everyone. I'm very happy to see that we are beginning the fall with this beautiful series. Good afternoon, colleagues and students. Thank you for joining us for today's Dr. Nasry Michelen Allied Health Lecture Series. The series is named in honor of Dr. Nasry Michelen, the first president of Eugenio Maria de Hostos Community College. These lectures are now part of our regular activities at Hostos, presented thanks to the talented and generous collaboration of members of the Nasry Michelen Foundation, whose endowed scholarship also supports our students pursuing careers in the allied health sciences field. There are few more relevant topics than the one to be discussed this afternoon. No less a source than UNICEF has stated, children are not the face of this pandemic, but they risk being among its biggest victims, as children's lives are nonetheless being changed in profound ways. Yet, as we read the statistics of these past few months, more and more children are becoming the face of the devastating impact of COVID-19, in particular in parts of the country that lag behind in vaccination rates. The poorest and most disadvantaged children and the communities in which they live bear the brunt of these changes. The economic effects of COVID-19 are as dire and potentially as long-lasting as its medical effects. Teachers across the world have wrestled with the negative impact the pandemic has had on children's education. The mental and physical consequences of lockdown have also been well documented. This is a powerful loss for our present and our future, as the future of humankind is held in the hands of our beautiful children. Clearly, it is time to better understand these and other related problems stemming from the aspect of the global health crisis and to contribute to their solution. We are so very grateful for the presence of such a distinguished group of lecturers today. Talented and very busy people who have taken precious time to be with us this afternoon. I know you join me in welcoming our guest speakers, Dr. Rocio Hernández, Dr. Juan Tapia Mendoza, and Dr. Bienvenido Fajardo. I know this will be a pertinent and informative discussion concerning our most precious resource, our children. Bienvenidos a su casa, Hostos. Mil gracias y bendiciones.
Amen. Muchas gracias, Presidenta. Muchas gracias. Thank you very much, President, for embracing the lecture series and for always being so open to this type of conversations, which are very important nowadays when we talk about COVID-19, which today's lecture is COVID-19 and its impact on children and adolescents. And to begin the conversation, please allow me to introduce Dr. Rocio Hernández. She's Executive Assistant of Pediatrics 2000, and she's an Hostos alumnus. She graduated in 2001. We're very proud of that, of seeing one of ours as a doctor. She does significant work assisting those in need in the area of health and many other volunteer work. With that, Doctora, the platform is yours.
Good afternoon, Ana and everyone. Thank you for inviting me to be part of this lecture. As you said, I graduated at Hostos Community College in 2001, and from then I went on to medical school. I graduated in 2007 from Universidad Iberoamericana, UNIBE, in the Dominican Republic. And I came back to the States, and I'm working with Pediatrics 2000. Well, let's begin with the presentation. And today we are going to talk about COVID-19 in children and adolescents. The impact of COVID-19 in children and adolescents has been an emotional roller coaster. For those of you who are parents, grandparents, caregivers, and teachers, you know better than anyone how your child life has been impacted. Although kids are remarkable resilient, many have struggled to the changes just like everyone else, with the difference that they are not old enough or mature enough to understand why they are feeling the way they are. And I want to ask Dr. Tapia to give us some statistics of the most recent COVID-19 for adults, for adults and children and adolescents.
Thank you, Dr. Hernandez. You know that the pandemic started sometime in December of 2019. And as of September 16, 2021, the data available reports that about 5.5 million kids have come down with COVID-19 disease. We are talking about 5.5 million kids. And during the past 4 weeks, there's been a tremendous explosion of COVID-19 in children, and we are seeing between 225 and 250 new cases of COVID-19 in kids. This represents more than 1 out of every 5 new cases of COVID infection. And also in the month of August, there was about 30,000 kids throughout the United States hospitalized with COVID infection. And we know that as the virus mutates, new strains develop. And these new strains, such as the Delta virus, now accounts for about 99% of all new infections, hospitalizations, and deaths, not only among kids, but also in adults. Dr. Hernandez, throughout the pandemic, we have heard that COVID infection in kids is very mild, and most of the kids do not even present any symptoms, and the parents might just think it's a cold. What do you think? Why are we getting so many new cases now?
Well, as the virus travels from a person to a person, it changes its physical structure. This is called a mutation. These mutations can be more contagious and make people sicker. This can lead to hospitalizations and death.
Okay.
I don't know if Dr. Fajardo wants to add.
Dr. Fajardo, do you want to add something to that?
You need to unmute, Dr. Fajardo.
Sorry, now you can.
It's fine now.
Yeah. No, what Dr. Hernandez just said is right. So there is a lot of problem right now that we are facing in the community, in your state and probably across the world. So the children, at the beginning, as Dr. Tapia said, we thought that the children, they were not getting infected at the beginning. However, it is all the contrary. The children are getting infected as much as the adults. And because of the infection that you just mentioned, when an infection goes from one person to another that is not vaccinated, which is very important to clarify, we get a mutation. You get the replication of the virus. And that is why we are involved in this situation right now. Because every time the virus lands in anybody that is, not vaccinated, at least, that get the disease, the virus start mutating. And that is why we're going to get so many variants right now, like the Delta variant and the MU, the new one that is already in the United States.
Thank you. I am going to come back to Dr. Tapia Mendoza, and I should say that Dr. Tapia Mendoza is the president and CEO of Pediatrics 2000 group. and the Somos Community Network. He's also a board member of the Nasry Michelen Foundation and has been recognized internationally. We're very proud of that, and we're very proud of your contributions to the college and to the overall international community. Dr. Tapia, would you like to add something to what Dr. Bienvenido Fajardo has commented on? Dr. Bienvenido Fajardo, by the way, is a medical doctor. He's a clinical instructor at Columbia University, the College of Physicians and Surgeons. He's also assistant attending physician of New York Presbyterian Hospital and CEO of Bronx United IPA, among many other distinguished recognitions and work that he does. The floor is yours. Let's continue.
Dr. Tapia. Well, I would like to add, since we have a lot of students that are between 18 years of age and 21, that currently in the United States, there's about 50 million kids that are eligible for vaccination and some that are not eligible. And our concern is that half of the kids that are 12 years and above that qualify to get the Pfizer vaccine have not received the vaccines. And as we know, we are going under the latest certification process by the FDA and the CDC to approve the vaccine for kids from ages 5 to 11. And this is extremely important because kids not only are getting infected, but since most of them do not present symptoms, these kids can bring the virus home to vulnerable adults. Because we know in our communities, Latinos, Afro-Americans, and other people of color, we live with the extended families. So we have the uncles, the grandmothers, the fathers, the mothers, and many of them have chronic illnesses such as diabetes, heart disease. Some of them have cancer or other illnesses that cause your immune system to get weak. So these people are very susceptible to getting severe coronavirus infection. So the only way that right now that we can protect kids under 12 is having kids over 12 get vaccinated. And the kids that are in school, we need to make sure that in the schools we have good ventilation, social distancing, the wearing of masks for kids 2 years and over that can wear the mask. But more important, every adult at the school setting that has contacts with children should be vaccinated. And if they don't want to get vaccinated, they should be tested at least once a week for the coronavirus.
Interesting. Are there particular sites that you would recommend for people that are disoriented in terms of where to go? Because I know that here at Hostos, we have a testing site.
Luckily,
other people in the community
yes,
are a big concern, and sometimes they're afraid to.
Many years ago, Dr. Antigua did a study, and the surprise finding was that Washington Heights and the Bronx are full of primary care physicians. So the first point of contact for anyone is to see their primary care physician. We are lucky that most of us have a primary doctor, de confianza, that you can trust, not only with your kids, but with the problems of the entire family. So the best place to get information is through your doctor. But we also know that at the schools, the mayor of New York City recently announced a program where Somos is going to be doing coronavirus testing, not only to the students, but also to the teachers, the administrators, and all the ancillary staff. And I understand that we are doing coronavirus testing at Hostos, or that the city will soon be doing it.
Yes, we're very happy to have the testing site here.
About the children, let me say something which is very important. The children, they get very sick too, because they get a multi-system inflammatory syndrome in children, which could be a deadly disease because of the coronavirus. So the parents, they have to take that into account, that the children, they get as sick as the adults, particularly those children that they have a comorbidity, meaning that they have, as Dr. Tapia said before, heart disease, lung disease, asthma, a lot of diseases that they may have. So we were under the impression before that they get the coronavirus and they didn't get that sick, that was a minor infection, but it is not. They get a multi-system inflammatory syndrome, which could be lethal, fatal for the children. So that's why it's very important that the 12 and above, they get vaccinated. And when we get the permit from or they go ahead from the CDC or from the government, from the 5 and above, I agree, they have to be vaccinated also, immediately.
Yes, and Dr. Fajardo, I would like to add that when you're talking about the multisystemic inflammatory disease in children, it is very similar to another disease called Kawasaki. But for young adults, especially young adults that attend college and community colleges, this disease, unlike Kawasaki, is more common in older children than in young kids. So that's why it's even more important for our adolescents and college students to get vaccinated.
Yeah, they may develop, and you're right, they may develop not only with the heart disease, they may develop myocarditis and pericarditis, but they may develop also problem in the coagulation cascade. They may develop thrombosis, and every single symptom and sign that the adult might present for coronavirus, for COVID-19, the children may present the same thing. So it's the same symptomatology.
A question that I have, there are a number, again, as I mentioned, of adults and students and children, adolescents that are very afraid of being vaccinated. What recommendation you have for them to feel comfortable and understand the importance of this?
Dr. Hernandez, do you have any opinion, any ideas? I think she's in mute. But, okay, go ahead. Sí, doctora.
Ya, ahí la vimos, sí.
Yeah.
Go ahead.
Well, the recommendation is that the vaccine has been proven that it protects above 95%. So they should not be scared to get the vaccine. I recommend everyone who is eligible to get the vaccine to go and get it. It is safe, it protects you. And by vaccinating yourself, you also contributing to the community, and also encourage other people in your family, in your neighborhood, your co-workers to get the vaccine also.
Yes.
Let me add something there.
Yeah.
I tell all my patients today, I'm talking to patients, I have patients outside, I'm still working now. But let me tell you something. The vaccine won't give you COVID, never. Because that's the mistake that, they're afraid, I want to get COVID because the vaccine had the virus. No, the vaccine won't give you COVID. Please, get vaccinated.
Mm-hmm. And Dr. Fajardo, one question that we get a lot from our teenagers, the girls, they are afraid that somehow these genetic engineered vaccines like Moderna and Pfizer are somehow going to interfere with their ability to get pregnant. So this is a very common complaint that we get from kids. They say, I don't want to get vaccinated because I want to have kids. And I've heard in social media that the vaccine affects women's fertility.
Well, I have news for them. The messenger RNA, that is the genetic portion that the vaccine has, Moderna and Pfizer, what they do when they get into the system, into the body, they stimulate the immune system. They get a codification and tell the immune system what to do, and then they get rid of the body because they are very liable, and they disappear immediately once they do their job. So they don't have the messenger RNA that they are supposed, that they think that we have a chip we're going to get there, we're going to change our genetic system in our body. It doesn't work like that. So
there's no evidence that the vaccine alters your genetic makeup, like you can turn into a monster or something else.
No.
We've heard that, doctor. We've heard that often from people, that it can change you forever.
Listen, our cells, they're full of messenger RNA, remember, and those are the messenger RNA is the genetic protein that will give you the information in the system, and we need a transporter like the messenger RNA to give the information to the immune system to start producing the anticuerpo or the antibody to protect the system against the disease. That's it.
Oh, I see that. Another question that I usually get, I get it, is that there are some parents that they feel that it's highly important to have bilingual personnel that could explain to them all of this information that you're sharing in Spanish. You think it's important to have bilingual personnel to talk to the parents that are Spanish speakers only?
Well, I would like to add that the most important thing in a doctor-patient relationship is that the doctor understands the culture of the patient and is sensitive to the patient's needs. And many patients don't look at us in the eyes because of in our custom, as a sign of respect, you do not look other people in the eye that you think, that you consider that deserve the respect from you. And many other parents that come in and many other patients, like Dr. Fajardo knows, they might come in for a reason, but by Dr. Fajardo talking to them and knowing that they have his trust, they will be able to talk to him about what really is bothering them. So I think the primary care physician is an excellent source of information, especially fighting all the misinformation that we're getting from social media. I think the colleges, the community colleges, and other organizations in the community are doing an excellent job in the community, educating people, but this is a constant battle. Every time I hear the news, every time I open any social media, I hear somebody blasting the vaccines.
Interesting. I have a quick question for the three of you. Why did you decide to go into medicine? What motivated you to be doctors? Empiecen.
Dr. Fajardo, I want to learn from you.
Well, when you hear what I'm going to say, you're going to be in shock. You're going to be surprised. I was going to be an architect, and I have a major in math. So, but that doesn't mean that I didn't want to be, because in my family, we have physician, not physician. And I'm coming from a family that have few physicians already. So probably I was looking at them, seeing my family, my cousin, that they were physicians, and that was in the back of my mind. However, when I went into, when I finished college and I went into faculty, my cousin, who is a GYN in Dominican Republic, he went to register medicine, and I was supposed to register in the School of Engineering. So, and I said, you know what? I'm going to continue with you because we did college together. And he said, are you sure? The family is going to kill you because you are supposed to be an engineer, an architect. And I said, no, I'm going to continue with you. But let me tell you, this is the best thing that has happened to me ever. I think I was a doctor, a food-training doctor when I was a kid, and I used to see my family growing up being a physician. So, and probably it wasn't me, and I like what I'm doing so far.
Thank you. And Dr. Tapia's story is very interesting. He's an Emmy Award nominee. There was a documentary done about his life, which is fantastic. Congrats. You want to share something about why you decided to become a doctor?
Well, everybody has a dream. And every child, I've never seen a kid that says that he wants to be a drug addict when he grows up, or that he's going to be a bank robber, you know, or he's going to go into dealing or doing anything illegal. Most of my friends used to say they wanted to be architects, engineers, doctors, lawyers. But most kids that become doctors, they have this dream since very early in life. And my advice is that when you have a dream, no matter how difficult it seems, and no matter how many people, even your school counselor, if they tell you that you're not good for a certain career, don't believe them and go for it. And us as adults, the best thing we can do is encourage our kids. Don't call them stupid. You know, don't tell them that they're not good for anything. Don't fight with them if they want to drop out of school for a while. We always got to support them, because young kids, you know, teenagers are very sensible. And sometimes we have the best intentions, and by us trying to punish them, what they do is that they'll enclose themselves, and they sort of lock up, and they will not speak to you. And not only that, they might start even hating their parents, because they feel that first, that them as kids did not live up to the expectations that we have of them as kids, you know, when they grow up. So you have to keep on dreaming, but keep your feet on the ground every day and study very hard, and try to be the best that you can all the time.
That's great. That's great. Dr. Hernández.
Well, I always wanted to be a pediatrician since I can remember. And this is all because my pediatrician, she used to do home visits, so I rarely had to go to her clinic. And when my mom used to be, when she finished and my mom was going to pay her, she will say, no, I'm not going to charge you for it, because I do it from my heart. This is what I love to do. And she always used to tell me, always do something that you love. So to me, that was interesting, because you didn't get paid for it, but she was doing something that she loved. So I always wanted to become a doctor. So when at the age of 15, I moved to New York. I didn't think I was going to be able to become a doctor, because I came undocumented. So I didn't have any papers. When I was admitted to Hostos Community College, I had to pay out of pocket, because I didn't have any papers. So I had to work full time and go to school full time. So I saw that as an impossible thing to accomplish. Once I had in 2001, I got my green card through my grandmother. So that was at that time I also graduated from Hostos. So I saw that as an opportunity to go back to Dominican Republic and go to medical school. And I came back in 2007, and since then I've been here. And
Fantastic.
That's my
persistent. That's what our students need. Persistence. That's very important. It's very, very important.
Yes.
Orgulloso, ¿verdad? Very proud of what she has done with all the challenges that came up, and she persisted.
Thank you.
Is there anything else that you would like to add to your presentation? I'm asking this question to the three of you.
Dr. Fajardo.
No, speaking about COVID-19 is very broad. We can talk about COVID now for the whole afternoon. You know that, Dr. Tapia. You've been involved since day one, and we've been watching that. Everybody's been involved. The last year was a year that I want to remember ever, because all the situation that we used to see out in the street, doing telemedicine, patient dying back and forth, because we didn't know what was going on. it's sad what is being happening. And that's why we encourage everybody out there, please to get vaccinated, because we don't want to go through this again. And COVID is not over yet. It's going to take a long time. Remember the Spanish flu in 1918. And now we surpass the amount of death, the death rate from the Spanish flu. So what I mean is that it's still here because everybody in the world, 7 to 8 billion people in this planet, they have to be vaccinated. And we encourage everybody, please, to do that, because you never know what is the course that the disease is going to take. And we have to be very careful.
Okay. There's a question on the screen before you answer, before you continue, Dr. Tapia. There's a question, and either one of you can answer it. And the question from Alva Lynch is, does the Kawasaki disease affect older children more than younger?
Well, we were just mentioning that Dr. Fajardo mentioned a very rare condition that presents with kids after they have COVID, and it's called pediatric multisystemic inflammatory disease that is very similar to Kawasaki. And we don't know the etiology of Kawasaki. All we know is that it usually precedes a viral infection. But Kawasaki is more frequent in younger kids, and a lot of times it leaves long-time health problems, especially related to the heart and the aorta. While multisystemic inflammatory disease is more common in older kids. And remember, coronavirus is a developing disease. So we don't know what's going to happen in a few years. But what we do know is that we have kids now that are getting chronic COVID, which means symptoms that can persist for months after the initial infection and even after the child tests negative for COVID-19.
Now that you're talking about Kawasaki, let me add something that's in children. In adult, those type of diseases in the artery, in the aorta, will be Takayasu disease. So it's we consider it's like the similarity. The difference is that the one is in the middle caliber artery, and the other one is the major cardiac artery in the aorta. Exactly what you say, but we see it in adults also. They're very rare disease anyway. We don't see them, every time we see, we know that somebody has Takayasu, it's a case report. So,
oh, yes. And Dr. Fajardo, now that you mentioned that, some of our patients that are afraid of getting vaccinated, they told me that they have heard that the vaccine causes inflammation of the heart, and that's why they don't want to get vaccinated. And the fact is that coronavirus causes more myocarditis, is the one responsible because of what you said, the inflammation of the blood vessels.
Absolutely.
Wow. So is there, again, anything else you would like to add to your presentations before I ask the president to say, I don't know, if she has a question or closing remarks? Rocio, Dr. Fajardo?
Well, I would just like to add that New York has been the leader, I would say, in the United States. We were the first ones to get infected. We had thousands and thousands of people that died, but we were also the leaders in controlling the infection rate, in using the mask mandates, the social distancing, and also the quarantine. Remember that our economy was closed for a few months. However, we should remember that New York is one of the main entries of the United States from people from all over the world. And as long as most of the people around the world are not vaccinated, we are not going to be out of the woods, because we have a lot of people that live in the Middle East, in Africa, where there's hardly no vaccinations. And these people travel back and forth to the United States. So sooner or later, any new strain of the virus that develops in unvaccinated people is going to come knocking on our doors. So that's why we still have to use masks, hand washing, social distancing. And now that we have the vaccine, we should encourage our families and our communities to get vaccinated.
Do you think that COVID-19 came here to stay? It's not going to go away.
It's going to be just like influenza. And we see a future where every year we might need to get a booster shot of one type or another against the coronavirus.
I see. Dr. Fajardo, you were going to say something, sorry?
No, I agree with Dr. Tapia. He's absolutely right. So the COVID-19 is going to stay here for many years. I don't know for how many years, but it's going to stay here for a long time. And he's right. We may have to get a booster every year, like the flu. Another thing that I want to add is that a lot of people, I was participating in a webinar 2 or 3 weeks ago. And I can tell you one thing, since you mentioned the flu, if you get the vaccine, you should get either the flu or the vaccine 2 weeks apart, one from each other.
I have a question.
One
Get them
apart from
together
the
also?
other.
Not to get...
Not the same day. You cannot.
Not the same
get them
day.
both the same day.
That's a recommendation for the CDC, 2 weeks apart. Now that you mentioned the flu, I remember that. I said, oh, let me add that. Okay.
Now we know that. We should not get it on the same day.
Yeah, well, there is a vaccine that is coming with the flu now. And you know that, Dr. Tapia, the Novak. That's a new vaccine that is coming out. That is going to be a combination between the COVID and the flu vaccine. I don't know.
Wow.
So it's out there. It's not out there. They're working on that right now.
Mm-hmm. So this is going to follow the same tendencies as for other vaccines that we have, like the measles, the mumps, the rubella, the polio, all combined. So and varicella. So this is the future. And also we need treatment, oral treatments for the disease, as well as rapid testing. Because without testing, we're never going to know how many people are really infected and where we can focus our resources. Like, for example, if we know that we're getting a lot of positive coronavirus tests, that we have to put more emphasis on prevention. And we should follow other countries' advice, which is many other countries in Europe are doing rapid tests. And rapid testing are reliable for diagnosing active infections. And they can be used, for social gatherings, for parties, family events, and even for school. If we had a way of doing a rapid test that can tell us right away if a kid has the disease, this can prevent many infections. Since we know that the PCR, the routine test that is done via the nose, can take sometimes even a couple of days to get the results back.
Excellent. It's wonderful that you're giving us all this information, because we're in the middle of this public health crisis. And sometimes I see people that they lax, they forget to put their mask, and they forget the social distancing. And I guess mentally, they get tired of all of the new restrictions and regulations. So it's good that you remind us that we should still be alert when it comes to this pandemic. Rocio, I thought you were going to say something.
Well, we have to remind ourselves that this from 2019, this is going to be the new normal. We always will have to carry our mask. We always have to be at a distance with other people, and we all have to protect ourselves. Nothing is going to change until the majority of us are vaccinated.
Thank you. Thank you. Well, I don't see any more questions.
Well, I have a couple.
Okay.
I have a couple.
Okay, President.
I just hate, I have actually like three, but I just hate to take time from this busy. I mean, Dr. Fajardo said he's in his office dealing with patients. He's taking the time. I can't tell you how absolutely generous of you that is. So I'll mention, and then the three of you, Anna will manage that. I'll put the three questions out there. Number one, if you want to share one beautiful moment that you experienced during this pandemic, dealing with your patients, one moment where you felt, boy, I am so happy I went into medicine because I could do this. So that's one question. Second question, do you care to have an opinion about the mandate to have the children back in person in the public schools? And number three, for those my age who had, in fact, Dr. Tapia, it was in your Somos clinic there at Taft High School that I had my Moderna shots. Wonderful service. Do I need to have, if I'm going to take a booster, does it have to be Moderna, or could it be, for those who want to have the third shot, could it be any of the others? Or are they interchangeable or not? Okay, so I'm going to mute myself, having imposed on you, and Anna will manage those three. You know, first, a beautiful moment. Second, the kids in the public schools. And third, this para los viejitos. Okay, what do we do with that?
But I would like to answer about the school mandates and the vaccines. I agree with the city, with New York City's mayor, that we cannot force, we cannot scare people, and we cannot mandate. Our job is to try to convince people by the data, using science instead of politics, and reminding everyone that each one of us either knows somebody that was very sick from COVID-19 or somebody that has passed away from COVID-19. So I believe that, yes, mandates for having tested if you don't want to get the vaccines, but we should not ask for a mandate to get the vaccine, because what's going to happen is that this is going to turn into a whole legal mumbo jumbo, and we're not going to be able to move forward with the vaccinations until the case goes to court and a final decision is made. So I feel that the best, el mejor camino, or the best way, is through education, fighting the myths, convincing our community to getting vaccinated, starting by ourselves getting vaccinated.
Great. And there's another question from the president about a beautiful moment during all this crisis that you went through, or that we're still going through because of the pandemic. In between all of this, can you talk about a beautiful moment within this that you experienced?
Well, we have a lot of experience during the pandemic. And there are good, patients that we have more than, I don't know, sad moment than beautiful during this pandemic. That's all I can tell you, because I have seen so many people, not only patient friends dying, but I have seen some of them that they have made it, and that has been beautiful. I have a few patients, including elderly of my transplant patient, that I thought that they were going to die, and they made it. So that was a beautiful thing. The kidney transplant patient that I take care of. So, but it's been sad. It's been a very sad year, 2020 and 2021. So, and I don't know if I can compensate. I can talk about one or the other. I'm very happy that a lot of guys, a friend of mine and patient, they have made it. And again, is, you know, I have patients over 70 that they have kidney transplant, and believe it or not, patients that are being intubated and they're back. And I have patients younger than that, that they were intubated and they didn't make it. Yeah, they died. So it goes both ways. And for the president that she got the Moderna, I'm going to give her an advice. Moderna is a messenger, nucleic acid, you know, nucleic acid, RNA vaccine. What I'm trying to tell you is, so is the Pfizer. So you can use either one of them. However, I prefer you to stick with the same brand that you used before with the Moderna, because even though they have the same messenger RNA, both of them, and they might differ one of the biochemical structure, like a nanopeptide, which will stabilize the temperature. That is why you see that the Pfizer, it had to be in ultra cool temperature, and the Moderna doesn't have to do that. And the Pfizer and the Moderna last longer in higher temperature than the Pfizer. It's because of a nanopeptide that they have, a nanolipid peptide, if I can say that. So, but you can use one of them. However, I advise you just to take the Moderna, the same one that you use it. That's my advice.
That goes for me too.
So then you're going to have to come back to the Bronx and offer those at some point soon. Muchas gracias. Thank you, Dr. Fajardo, for the explanation. I was thinking about that, the fact that one had to be refrigerated a lot and the other one not as much. When I thought about it, but somebody said it's the same thing, and I said I better check with the people who know, since I have captive audience here.
Right.
Fantastic. I'll have one last question for the three of you. The same way you had a beautiful moment, I'm sure that you had moments that were very, very difficult and you managed. How was that experience?
Well, let me go first, because there was a person in the community that I'm not going to mention name. Dr. Tapia knows, and everybody knows. Very good friend of ours, you know, who died during COVID last year. So I was taking care of him. He used to be my patient, and I spent around almost 5 weeks rounding with him in ICU. He was admitted at St. Joseph Hospital in Yonkers. So I was day by day, twice a day, even at night, in ICU talking to the resident and to the attending. And when the remdesivir came on board, just to treat the patient, remember Dr. Tapia? When the remdesivir came on board? Mm-hmm. So I beg those guys, I kneel myself, and I say, why don't we give him a trial, or 10 days of remdesivir? And they said no in the hospital, because it has to be, you know, we have a policy here that the patient was so sick, they said it had to be ordered by the administration, something like that. I don't even know what I remember. I was fighting with them. Mm-hmm. And I said, but
compassionate use.
Yeah, exactly. And I was saying, no, but you can do that to me. And they said, I'm sorry, Dr. Fajardo, we have to do that. And then I said, why don't you use the Regeneron on this guy, the monoclonal antibody? And they said, well, you know, and to tell you a long story short, he died. He went into acute renal failure. Well, that's why I treat patients in ICU, patient with kidney disease, acute renal failure. He got dialysis like at least 4 or 5 times. He got fluid overloaded, you know, and I was with this guy in the morning, asking at night, because I didn't want him to die, and he did die, and that broke my heart. That was one of the.
I imagine the emotional load on you and the psyche.
Yeah, well,
Each one of you
I don't know if
goes
Dr. Tapia had the same problem that I had. You know, I used to talk to a lot of patients to telemedicine and do this, and the following day probably the patient died. One day, one of the study, 4 of my patients died in less than 2 hours. So I'm more, you know, it was a time that you don't want to go back and, you know, like a flashback. However,
but you learn to manage and to
well, I did
come back.
Yeah. We did, because what I did was I tried to get an entertainment late at night in the house to try to get out of the situation, and that's exactly what I did. I tried to learn something that was not in medicine. I tried to learn something, to learn whatever, and you know, and they say because you couldn't sleep too well, you know, you
learn from that experience,
and that was tough. That was tough. I don't know if Tapia can say something about that.
Well, my worst moment in the pandemic was when the wife of one of my partners called me that the ambulance was just about to take away her husband to the hospital. He was also a pediatrician. He was in the ICU for a whole month. She never got to see him until the day that he died. And then we had to wait like for 10 days to get one funeral home to give us 1 hour, 20 people to see him before he was buried. And that still affects me every day of my life. And seeing all those people that we see at the testing sites, you see how these poor people, a lot of them cannot walk. They don't have cars to get to the testing sites. They didn't have adequate follow-up or a place to keep them isolated until they knew the results or until the period of isolation passed, which in that time used to be 14 days. And then when I got sick, I got very sick with COVID-19. And what cheered me up is when I told my boss that I got sick, he said, "Oh, I'm so glad you got sick because we open up a new site in 2 weeks. And by that time you should be better." He didn't even tell me like, "Oh, I feel sorry for you." I feel sorry for you. You know, I hope you get better. No, he was just really happy. He said, "Oh, good. Because we're going to open up a new site in exactly 2 weeks. And you will be ready."
Well, at our end,
wait, I want to add, Anna, I want to add that one thing that impressed me is that for every healthcare provider that got sick, I saw at least 5 of them willing to take the place of those of us that went down.
Oh, that's so nice. Oh my God. That's terrible. That's why I think that the frontline healthcare workers and doctors like you, I mean, you deserve the best. The work that you're doing every day is incredible. And people like us, we really, really appreciate it. And I'm sure that the audience that we have here, they also appreciate the work you do. We have faculty, students, and staff watching your presentation, and they really, really appreciate on their behalf, on behalf of the college. Thank you for all the work you do. Thank you. Rocio?
Thank you.
Okay, well, I had a lot of sad moments, but I did lose an uncle during the pandemic. Even though his kids wanted to celebrate his 84th birthday, even though we advised them not to. So one of them was infected, he didn't know it, and he infected my uncle, and he passed 14 days later. So that was a sad moment for us and for the family.
I also have some relatives who passed away, so I know how it feels. Well, we have 4.5 minutes for closing.
And I think we'd have a question, Anna.
There's another question. Oh,
From
there's another question. Can you read it? Let me see. Oh, from Dean Gomez.
Joanna Gomez.
Dean Gomez, he says, thank you, Dean Garcia, for hosting this very informative section. My 10-year-old son, who is on the autism spectrum, wants to get the vaccine. When is it made available? What strategies would you offer to prepare him for this Herculean task, as he doesn't like needles?
Oh, welcome to the club. We have kids that are real fighters, that hate needles, and even adolescents. You see, I'm sure we have some students watching us, but you know what? You guys are also babies, because when you come to the clinic and you're 18 or 19 years old, you still cry when you get a shot. So kids that have developmental disorders, developmental delay, speech problems, behavioral problems, those kids are in particular danger of getting severe COVID infection. So we have to prepare them just like we prepare the kids for any other vaccines. And I'm sure that in the next few weeks, we are going to get a vaccine available. It's probably going to be the Pfizer for kids 5 years to 11 years old. So the wait is almost over.
I'm sure it is. Okay. We have some comments here. Say heartbreaking, all of this. God bless you all for your commitment to medicine. Diana says, thank you very much. And like I said, our audience is very, very appreciative. I also want to say thank you to the President, Chief of Staff, Diana Kramer, and Mr. Victor Santana, who's the one who handles the technology. I'm sure you spoke to him and he gave you directions. And to all the faculty, staff, and students who are here listening to this magnificent presentation. And to our President. President, thank you so much for always making time to have this type of conversations that are so, so important for our students, faculty, and staff, and the overall community that we serve.
We are going to extend an open invitation whenever you think you want to have a follow-up thing. It's not that long. If you even for a half hour, just to talk to the community, that would be so greatly appreciated. And I'm sure that Anna will facilitate that as well. Thank you, Anna. That was lovely facilitation, and thank you all. Hostos is very grateful for the work that you do, for who you are, and what you way to support the college. Muchas bendiciones.
Thank you.
Thank you.
That here we have thanking remarks saying that the presentation was wonderful from Dr. Osuna, Professor Osuna, Idelsa Mende, and Sarah Holland. Thank you all again for joining us and for being part of this presentation. And like the president said, we hope that you'll be able to join us in person here so that you see the
Yes, I will.
and all the work that we're doing here. Nuestra casa es su casa. And thank you to the three of you, because you're also part of the Nasry Michelen Foundation, and you have been contributing with scholarships for our students. And they really need it. We appreciate it. Thank you, thank you, thank you. Un placer los tenido. Muchísimas gracias. Nuestra casa es su casa.
Gracias.
Thank you. Bye-bye.
Bye-bye.